everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Alendronate. Its brand name is Fosamax. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Alendronate is classified as a bisphosphonate. It binds to bone hydroxyapatite and inhibits osteoclast-mediated bone reabsorption. In terms of indications for use, this medication is indicated to be used in the treatment of osteoporosis, and it can also be used to treat Pagets disease. Now before somebody was to use Alendronate, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Alendronate or any other component of the product, they would not be able to use this medication. If a patient had esophageal abnormalities that might delay esophageal emptying, they would also not be able to use Alendronate. Patients can't use this medication if they have hypocalcemia or low calcium. They would have to resolve this before they started therapy. It would be contraindicated in patients who have the inability to sit upright or stand for 30 minutes. And patients at an increased risk of aspiration should not be given the oral solution. Now in terms of precautions, mineral metabolism disturbances such as vitamin D deficiency should all be corrected before this medication is administered. We should avoid giving this medication to patients with Barrett's esophagus, as there may be an increased risk of cancer. Patients should be made aware that worsening of upper gastrointestinal diseases may occur. Patients should also be told that esophageal adverse events, such as bleeding, have been reported. Gastric and duodenal ulcers, some with severe complications, have been reported. And some patients have experienced atypical fractures of the thigh. Osteonecrosis of the jaw has been reported, typically after a tooth extraction. Some patients have experienced severe musculoskeletal pain. This can happen within days or months of starting therapy. And lastly, this medication is not recommended if a patient had a creatinine clearance less than 35 milliliters per minute. Now once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Alendronate, they can expect to receive their dose orally, as it is available as a tablet as well as an oral solution. If somebody is using this medication to treat osteoporosis, they would typically use 70 milligrams once a week, or 10 milligrams once a day. For Pagets disease, they would typically use 40 milligrams once daily for 6 months. As with all medications, there are some side effects or adverse reactions that patients may experience while using Alendronate, so I'll go over some of those here now. Up to 6% of patients may experience abdominal pain, and up to 3% may experience constipation. 3 to 4% of patients may experience diarrhea or flatulence. Indigestion may occur in about 4% of patients, and up to 29% of patients may experience vomiting. 2.5% may experience a headache, and fever can happen up to 24% of the time. Now, some more rare but serious side effects would be heart failure, duodenal or gastric ulcers, esophagitis or a hypersensitivity reaction, and finally bone or muscle pain. That's all we're going to talk about today with Alendronate or Fosamax. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.